Hey everybody, this is Dr. Adam Rinne. I'm speaking to you today about the impact of stress on your metabolism. This is from an article I came across in Frontiers in Neuroendocrinology in the 2018 volume 49 version. This came out in April of 2018. The authors are Martin Picard, Bruce McEwen, Alyssa Epple, and Carmen Sandy. So this image really depicts a scenario that we see a lot in metabolic syndrome. So metabolic syndrome, if you don't know what it is, it's a complex of metabolic shifts in the body that are starting to express themselves. So we see high cholesterol, high blood sugar, possibly type 2 diabetes, hypertension, and sometimes we also see with this, it's called non-alcoholic steatohepatitis or NASH. When looking at this diagram, you can really see what's going on, and perhaps it will enlighten us to see how we can reverse this condition. So you can see here on the left that as stress enters the body, the mitochondria produce something called cortisol. And cortisol is an adaptive hormone to stress. So we'll see in a second just the actions that's taking place in a scenario. Stress can be perceived from smell, taste, sound. It also can be something that is generated by a process going on in the body like infection. We can also have chronic elevated stress in our life from post-traumatic stress disorder or post-traumatic stress syndromes, which is a hypervigilance that develops after experiencing a near or potentially life-threatening event or witnessing a potentially or actual life-threatening event. We also can have chronic stress elevation from chronic sleep disruption that takes place in insomniacs, people who have sleep disorders such as sleep apnea that is not well treated. So what happens when stress is elevated? We produce something called cortisol. Cortisol is meant to essentially keep us alive. It mobilizes nutrients so that organs are fed. So that's a good thing, especially if nutrient supply is low or if we need to quickly get out of the way of a car or run from an animal. However, also this can take place even if those situations are not apparent. So what happens when cortisol is released, we have something called lipolysis, where the organs will release fat storage, and it is released in the form of triglycerides. Also, gluconeogenesis will take place from non-carbon sources. So this means glucose is being generated in the body without having to eat. So in the liver, there's something called glycogen, which also is in muscle. And cortisol will help cleave up glycogen to release glucose. So all of a sudden we have triglycerides and glucose traveling around in the body, which is creating extra energy. Now, if someone was in a deprived state, say they were underfed and they needed to quickly move to get out of danger, this is a beautiful system. However, in a situation where they are well fed, however, experiencing stress of a perceived stress, then a well-fed person is now being overfed by the body. So we have this increase in circulating glucose and lipids, which is sort of this extra supply of energy. We have energy excess from nutrients. If the stress doesn't stop, this continues. As long as this person is still feeding, they are going to be making fat storage, and more glycogen, and we have just kind of this vicious cycle that sets up. So you can see in these graphs that these graphs here will track fasting glucose and something called HOMA-I, which is an insulin resistance marker used for type 2 diabetes diagnosis and monitoring. So we can see that as plasma cortisol goes up, we can see that the insulin resistance goes up, and as plasma cortisol goes up, the fasting glucose goes up. So, and on the right here, we can see that as the cortisol goes up, we see more triglycerides in the bloodstream. So this is a situation where do we go to treat it? So this is potentially the root cause of this situation. Without stress, then perhaps the body's innate regulation would take place and we would not see such an unstable amount of glucose and lipids in the bloodstream. Everybody has stress, so part of this is figuring out if we can remove excess stress. The absence of stress is not good, but excess stress is sort of what drives this. So working with an integrative practitioner might look something like this. You could work on mind-body approaches to address perceived stress and learn how to generate an awareness in your day-to-day functioning as to what triggers your stress response. You could also work on sleep restoration with an integrative practitioner to help look at barriers to a good night's sleep. Integrative practitioner might also look for underlying infections, either in the gut or in the bloodstream, that's activating the immune system, that's increasing stress. If you're dealing with something like post-traumatic stress disorder, it's really important to work with psychotherapists that specializes in EMDR, which is a technique that helps the amygdala in the brain become less hypervigilant and helps process really troublesome events so that there isn't as much arousal when thinking or when triggered in relationship to those events. So, this is one of the situations where we see this pop up in metabolic syndrome, which is kind of a combination of high blood sugar, possibly type 2 diabetes, high triglycerides, and high cholesterol, also usually hypertension and obesity. And some of these patients also deal with something called NASH, or non-alcoholic steatohepatitis. So if you have any questions, please leave some comments below. I just wanted to share this because this really paints this picture really well. This is Dr. Adam Rindy, Sound and Integrative Health, Bellevue, Washington.